Good morning. It's a pleasure to be here with Dr. Cynthia Matossian from Doylestown, Pennsylvania. Thanks so much for being here this morning.
Thank you very much, Jonathan, for having me here.
It's always great to have you. I know that you had presented on a really interesting series of patients where you studied ocular sealants in regard to clear corneal incisions. Can you tell us a little bit about that series?
As cataract surgeons, we always face a subgroup of patients who I consider, in quotes, to be high risk. And obviously, these patients need additional attention preoperatively, during the surgical procedure, and postoperatively. And in this subgroup of patients, I did a series where I applied the first FDA-approved ReSure Sealant. It's actually a hydrogel sealant. It is not a glue. And you paint it on your main corneal incision for a watertight closure.
Now, let me ask you, Cynthia, what classifies as a high-risk patient, and how do we identify those patients?
I think that's subjective, Jonathan. In my series, I included folks who were immunocompromised, people who were undergoing chemo, people who were concomitantly undergoing anti-VEGF injections for AMD, people who were MRSA positive, people who were monocular, and we had to do that additional level of safety for the patient.
Can you tell us a little bit about the outcomes in your series?
What we looked for was visual acuity, pain, IOP spikes postoperatively in patients with a ReSure Sealant. There were no statistically significant differences in patients who received the ReSure Sealant in terms of a difference in vision, IOP, or pain and discomfort. There was no foreign body sensation, since this hydrogel sealant is made out of the same material as a contact lens. It's most comfortable.
Well, it's interesting that you mentioned that, and I'm glad that you found no statistically significant difference in those parameters. Some of our sessions in the past have focused on the foreign body sensation that occasionally occurs with this sealant. I wonder what it may be about your technique or about this specific series, why people didn't have that significant foreign body sensation.
In the past, fibrin glues or cyanoacrylate glues have been used to seal incisions. They're very brittle, especially the cyanoacrylate, very uncomfortable, often requiring a bandage contact lens. Whereas the ReSure Sealant is the first of its kind. It's actually made of this very lubricious, that's a new word I learned, lubricious material that is the same as a bandage contact lens. Very, very comfortable.
And so going forward, Cynthia, do you think that this type of sealant will become more mainstream in routine cataract surgeries, or do you think it really is best suited for those high-risk cases?
If I could, I would use it on every one of my patients, because studies have shown that there's a surprising number of leaks, even in well-constructed incisions with minimal amount of pressure. But obviously there's a cost to this, so we have to be cost conscientious, and therefore I reserve the ReSure Sealant, at least at the present time, for patients I consider high risk.
That seems to make good sense. One final question as we close is about whether the ReSure Sealant should be used for the paracenteses as well, or any other incisions that have been made for, say, an iris expansion device, for example. Would you think that the sealant would be appropriate for those smaller incisions, or is it really best suited for the main clear corneal incision?
Currently, it's only FDA approved for the main clear corneal incision.
Sure. And I wonder if in the future we will see additional uses for this type of application, perhaps in non-clear corneal incisions such as scleral tunnels and other types of incisions that we may do in surgery. Well, it's so interesting that you're able to present this series for us, and I really appreciate your being here this morning. Thank you.
Thank you very much.